In Mexico, Missouri, there is a building that used to be the beating heart of Audrain County. Audrain Community Hospital opened its doors in the early 20th century and spent more than 100 years as the first place people went when something went wrong. When a baby was coming, when a heart was failing, when an accident happened on a rural road, and minutes were the only currency that mattered. For over a century, it was there. In March 2022, after a series of management failures under a company called Noble Health and its successor, Platinum Health, the doors closed. Just like that, the first community cancer center in the state. Gone. The people of Audrain County did not stop getting sick. That is the part that never makes the press release. When a rural hospital closes, the county does not stop needing one. The county just stops having one. And the people who cannot drive 45 minutes or an hour to the next nearest facility, the elderly, the poor, the working families without reliable transportation, they make a calculation. They wait. They skip the appointment. They treat the symptoms at home until the symptoms become something that cannot be treated at home. Then they drive to the emergency room that is 45 minutes away, usually sicker than they would have been if there had been a hospital close enough to catch the problem earlier. Subscribe right now, hit the button and the bell. In Monett, Missouri, Cox Monett Hospital announced earlier this year that it was closing its inpatient labor and delivery unit, citing the inability to recruit obstetric providers, the specific doctors you need to safely deliver babies. The hospital made the calculation that running a money-losing unit it cannot staff is not sustainable. Some patients in and around Monett now need to travel upwards of 45 minutes to Springfield to give birth. 45 minutes in a car, in labor, on Missouri roads, hoping nothing goes wrong on the way. This is not a hypothetical risk. High-risk pregnancies that cannot be monitored locally become emergencies that arrive at distant hospitals too far, progressed for the best possible outcomes. The distance between a rural woman in labor and the nearest hospital with a functioning delivery unit is a gap that has a documented relationship with maternal and infant mortality rates. The March of Dimes 2024 report found that 51% of Missouri counties are now classified as maternity care deserts, counties offering no obstetric clinicians and no birthing hospitals. More than half the counties in Missouri, the state that borders 8 others and sits at the geographic center of the country, has left more than half its counties without access to a hospital that will deliver a baby. Since 2014, at least 18 hospitals have closed in Missouri, at least 12 of them in rural counties. The Missouri Hospital Association's data shows that the closures are not stopping. More than 30 rural hospitals remain at serious financial risk, according to the Center for Healthcare Quality and Payment Reform. The metrics that predict closure: negative patient service margins, dependence on Medicare and Medicaid reimbursements that do not cover actual costs, physician vacancy rates that leave single specialty units unfillable, are present across a significant portion of the rural hospital infrastructure that still exists. The mechanism driving the closures is not mysterious and has been documented for years without adequate policy response. Medicare and Medicaid, the 2 federal programs covering the majority of rural patients, who skew older, poorer, and more chronically ill than urban populations, do not reimburse hospitals at the actual cost of providing care. Bothwell Regional Health Center in Sedalia posted its first profit in 2024 since 2018, and its CEO, Lori Whiteman, was direct about the math in a press release. Medicare and Medicaid provided 78% of payments for Bothwell's patients, and in her words, these programs pay well below the actual cost of providing care. Bothwell managed 6 consecutive years of losses before reaching profitability. Most rural hospitals do not have the reserves to absorb 6 years of losses. The chain of collapse when a rural hospital begins to fail is consistent and documented. First comes the specialist recruitment problem. A single physician leaving can eliminate an entire service line because small hospitals often have one doctor per specialty. When the OB/GYN leaves and the hospital cannot recruit a replacement, the maternity unit closes. When the maternity unit closes, the pregnant patients stop coming. When the patients stop coming, revenue declines further. When revenue declines, the hospital cannot compete for the next specialist. The spiral tightens on itself, and the outcome is predictable from the first step. The policy response has been to watch it happen. Scotland County Memorial Hospital in Memphis, Missouri received over $10 million in federal COVID relief funds and still posted a total margin of negative 8.5% and a patient services margin of negative 21.6% averaged across the last 3 years. The hospital has considered cutting inpatient services and maternity care. It is still open. Whether it will remain open is a financial calculation being made on thin margins in a county that cannot afford to lose it. Hit the like button. It tells the algorithm this story matters. Parkland Health Center in Bonne Terre has already made its transition. It converted to what the federal government calls a rural emergency hospital, a designation created specifically for critical access hospitals that cannot sustain inpatient care but can still serve emergency patients. It is currently the only rural emergency hospital in Missouri. It is the model that health policy analysts suggest could preserve some form of emergency access in communities where full hospital operations are no longer financially viable. It is also an acknowledgement that the full-service hospital is gone, and what replaces it is a more limited version of what existed before. The 95 of Missouri's 114 counties that are classified as primary care shortage areas, as of 2024, is the number that frames the scope of this problem most clearly. Not secondary care, primary care, the basic level of access that catches problems before they become emergencies. 95 of 114 counties cannot fill that need from local providers. Some have no full-time OB/GYN, no general surgeon, no psychiatrist, no pediatrician. The counties that have the least are losing the most because the hospitals that serve them are closing in the same order as the resources that might have saved them ran out. When Audrain Community Hospital closed in 2022, Heidi Lucas, Executive Director of the Missouri Rural Health Association, described the impact in terms that any rural Missourian would recognize without needing a healthcare policy degree. In rural health, really in healthcare altogether, she said, it's very much a continuum of care. If you're not addressing one section of it, it affects other portions, and you kind of have to look at all of them to move the needle in healthcare access. The continuum breaks when the hospital leaves. The doctors who were recruiting to the area because of the hospital leave. The specialists who came to conduct clinics at the hospital stop coming. The pharmacists and technicians and nurses who built lives around working at the hospital leave the county for communities with healthcare infrastructure. Studies show that after a rural hospital closure, low-income and elderly patients are more likely to defer or skip healthcare altogether because of transportation challenges. They do not replace their local hospital with a 45-minute drive. They replace it with nothing. They wait. They hope. They sometimes die of conditions that were treatable when caught early and are not treatable when caught late. The federal budget bill approved in 2025 includes Medicaid cuts that could cause between 130,000 and 170,000 Missourians to lose coverage over the next decade. The hospitals that are already operating on the thinnest margins, the ones whose patient service margins are negative 20% because Medicare and Medicaid pay below the cost of providing care, would absorb those patients as uncompensated care. Mercy Hospital System has set aside part of its budget for uncompensated care and still provides approximately $500 million worth of care annually that is not reimbursed. When 130,000 Missourians lose their Medicaid coverage, they do not stop getting sick. They go to emergency rooms they cannot pay for at hospitals that were already struggling to stay solvent, in communities that have already watched one hospital close and cannot survive another. In Mexico, Missouri, city officials signed a letter of intent in October 2024 with Boone Health to bring a critical access hospital back to Audrain County. The proposed plan outlines a Medicare-certified facility with emergency services and outpatient care. It is a plan. It is not a hospital. More than 3 years after Audrain Community Hospital closed, the county that built and sustained that hospital for over a century is still waiting for something to replace it. The people of Audrain County did not stop getting sick in March 2022. They just stopped having somewhere local to go when they did. That is happening in rural county after rural county across Missouri right now. Not as a future projection, as a documented current reality affecting communities that most of the people making decisions about Medicaid funding and hospital reimbursement rates have never visited and are not picturing when they vote. The broader context makes the trajectory worse. The federal budget bill approved in 2025 includes Medicaid cuts that health analysts estimate could cause between 130,000 and 170,000 Missourians to lose coverage over the next decade. Rural hospitals listed among those at serious risk include Scotland County Memorial Hospital in Memphis, Parkland Health Center in Bonne Terre, and Lafayette Regional Health Center in Lexington, the hometown of Senator Josh Hawley, who voted for the budget containing the cuts. The connection between the vote and the consequences for the senator's own community has not received significant coverage in Missouri's political press. When Missourians lose Medicaid coverage, they do not stop needing health care. They defer it. They manage symptoms at home. They wait until the situation is serious enough to justify an emergency room visit they cannot pay for. The hospitals that are already providing uncompensated care, Mercy Hospital System provides approximately $500 million worth annually, absorb the additional cost. The hospitals that cannot absorb it close. The rural counties that cannot replace them make do with whatever remains, which is increasingly nothing with a long drive on either side of it. Dave Dillon, Vice President of Media and Public Relations for the Missouri Hospital Association, described what a hospital closure means for rural communities in terms that go beyond the obvious. It often is the organization that recruits physicians and other caregivers to work locally, Dillon said. When the hospital leaves, the doctor recruiting mechanism leaves with it. The county does not attract a new primary care physician because there is no hospital to anchor the practice. The county does not attract a new specialist because there is no referral infrastructure to feed the specialty. The absence compounds itself over years until the county's healthcare landscape becomes a map of what used to be there. In Mexico, Missouri, city officials signed a letter of intent in October 2024 with Boone Health to bring a critical access hospital back to Audrain County. The proposed plan is a Medicare-certified facility with emergency services and outpatient care. A 3-year plan. It is still a plan. More than 3 years after Audrain Community Hospital closed, the county that built and sustained that hospital for over a century is still waiting. The people of Audrain County did not stop getting sick in March 2022. They just stopped having somewhere close enough to go when they did. That is the sentence Missouri's health policy debate has not yet found an adequate answer to. The data is documented. The pattern is clear. The hospitals are still closing. Subscribe if you haven't. Hit the bell. Drop a comment. Has your county lost a hospital or a maternity unit? Because the data shows it has happened to more than half of Missouri, and the people who live in those counties know it in a way that the data does not fully capture. Thank you for watching. The truth doesn't shout. It waits for you to look closer.